Hi, I'm Dr. Weniger from Weniger Plastic Surgery. Rhinoplasty is one of my favorite operations because we can fix not only cosmetic concerns, but also breathing problems. Sometimes these problems have been bothering people for years, or they could have been caused by trauma. There are two ways that we can do a rhinoplasty. One's called an open approach and one's called the closed approach. And it basically has to do with whether there's an incision across the bottom of the nose at the columella, or whether everything's done up through the inside of the nose, sort of by feel. The nice thing about an open rhinoplasty is that you can see everything really well. I can make a strong framework, and it's helpful for certain finesse type maneuvers. But closed rhinoplasties are great because there's less swelling, and it makes for a shorter surgery. We do both, really depending on what the goals are and what we have to accomplish in there. Most often, people just want to have their dorsum, or the top hump on top of their nose, taken down. That's a great operation, but I try not to do too much because I want to keep it looking chiseled, sort of model-esque, not sort of the classic old-fashioned ski slope sort of rhinoplasty. Oftentimes, which is really neat, a lot of people don't think about it, we can build up the top of the nose if someone has sort of a ethnic, maybe Hispanic or African American, sort of flatter, wider nose with wider nostrils. So we can again sort of go for a more chiseled appearance. Lots of things that we do with the tip. We can help wide tips or tips with bad sort of bulbous or boxy shapes. We can rotate a tip up if it's too low, or bring it down. And so between the tip and the dorsum, those are the most common things that we operate on. But sometimes we'll narrow the width of nostrils. We can deal with all kinds of different asymmetries, and we can improve breathing at the same time. When we're doing any of the cosmetic things, there's 3 different maneuvers that we can combine with that in order to improve breathing problems. The recovery is not as bad as most people think. We do leave a splint on for about 1 week. There's often a splint inside and one on the outside. You have to sleep with your head elevated. You can have bruising, and it can last up to 2 weeks, but some people don't have any bruising, so it's really hard to predict. People usually don't have much pain and can take pain medicines for 1 or 2 days. Now, although the splints can come off at about a week, you're not really completely healed until about 6 weeks, and it keeps looking better after that. In fact, the appearance of the nose and certainly the swelling improves for up to 3 years. Well, again, I'm Dr. Weniger at Weniger Plastic Surgery. Come and visit us at www.wenigerplasticsurgery.com.